Did you know that hormonal imbalances can cause a host of illnesses and symptoms ranging from menopause, osteoporosis, fibroids and breast cancer, to sleep problems, fatigue, and mood swings? Oftentimes, physicians are unable to find the answer to these health problems. Hormonal imbalances can disrupt a woman's life and present a real challenge for today's woman and healthcare provider. These illnesses not only affect a woman's health and well-being, but also affects her family and productivity in the workplace. If you or someone you know is faced with any of these health challenges, please pay very close attention, because in the next few minutes, we'll introduce you to a medical expert who's putting the future of women's wellness into focus. Dr. Eldred B. Taylor, a renowned board-certified obstetrician and gynecologist. Dr. Taylor is not only a highly acclaimed physician, but he is also a professional orator and author of the book, Are Your Hormones Making You Sick?
But first of all, I want to tell you what our goals are today. You're going to know more than most gynecologists. If you come in complaining of PMS or irregular bleeding or mood swings, and you're less than 45 years old, what is the doctor going to give you? Birth control pills. If you are over 45 and you're complaining of hot flashes or mood swings or not feeling quite right, what is the doctor going to give you? He's going to give you estrogen. What we're going to do is I'm going to teach you how to be a better gynecologist. I'm also going to teach you how to diagnose yourself. You will be able to amaze your friends and family, because your friends and family are going to come to you with those little problems that they're having, and you're going to say, I know what's wrong with you. You know why I know what's wrong with you? Because I went to a seminar last night and I'm an honorary gynecologist.
Dr. Taylor combines his exceptional training in conventional obstetrics and gynecology from Emory University and his experience with alternative therapies to provide comprehensive patient-focused care. Dietary and lifestyle changes, along with safe and effective natural therapies, can solve many problems, enabling patients to avoid surgery and synthetic medications and their many side effects.
First, we're going to talk about PMS. I tell you, most doctors don't understand it. They give you antidepressants for PMS, and now we're going to see why that doesn't make sense. Now, what did I tell you progesterone? Progesterone is an antidepressant, anti-anxiety hormone. So if for the 2 weeks before your period you don't have enough of that, you're going to have these mood swings, because you're going to have estrogen doing one thing and not enough progesterone to bind to those receptors that cause that help with depression. Then you're going to have those problems. What does estrogen do? It makes you hold on to water and makes things grow. So it makes fibrocystic breasts grow. It gives you the breast tenderness. It's called the swelling of extremities, because you're holding on to that water and you don't have the progesterone that's acting as a natural diuretic. So now you understand how estrogen and progesterone, if they're not working together, you can have all of these symptoms of PMS.
Dr. Taylor helps you learn about safe and natural alternatives to Premarin and Provera, and how salivary testing can detect hormonal imbalances often missed by blood tests. Did you know that hormonal imbalances can cause hot flashes, weight gain, decreased sex drive, and hair loss? Do you want to learn how to limit your risk for breast cancer, fibroids, and osteoporosis? Are you worried and stressed out? Dr. Taylor has helped Americans across the country to understand how stress can cause hormonal imbalances, which can affect productivity in the workplace and relationships at home and at work. Hormonal imbalances can also occur in males and increase their risk for prostate cancer and other medical illnesses.
And when you make a high level of testosterone, what happens is you start to have male pattern hair baldness, and you start growing a mustache. If you don't understand this, if you see that in an older woman, you're going to give her more estrogen. What is that going to do? That's going to make it worse, because that's going to make your body make more testosterone. Now, this lady said that she had decreased libido. And now the other thing is, because we don't understand women and men and the difference, we're giving women testosterone when they say they have a low libido. Now, this lady said she had no sex drive and her testosterone was 64. She ought to be hustling men on the street if she's got a testosterone that high.
Dr. Taylor not only speaks before groups of medical practitioners and students, but also speaks for corporations, community, and church and civic organizations about hormonal imbalances, breast cancer prevention, and healthy living throughout the United States. He is a sought-after radio and television personality and has been featured in local and national publications. Thousands of women and men have been galvanized to take action by making better healthcare choices after hearing him speak. Dr. Taylor's client list includes Emory University School of Medicine, Grand Rounds Department of Obstetrics and Gynecology, Duke University, the National Medical Association, American Cancer Society, Quest for Excellence in Women's Health Conference, North Carolina Academy of Family Medicine, Georgia Hospital Association, Professional Compounding Centers of America, Lucent Technologies, the Atlanta Business Women's Association, Sisters Network Breast Cancer Support Group National Convention, and numerous church, civic, and social organizations.
I'm pleased to present Dr. Eldred Taylor.
I want to begin by thanking you for the invitation to Prince Edward Island. I said last night I got to speak to some physicians in your area last night, and I said when Lisa Kelly called me, I said, sure, I'll come to Prince Edward Island. And then I eagerly went to a map to try and find out where it was. And I couldn't find it on the map. And so I had to do a Google search to find where it was. And I said, wow, I told my wife, I said, man, that thing is north of Maine. It's going to be cold up there. But I'm pleasantly surprised at your island. It's a lovely island, and I'm really pleasantly surprised with the turnout that we have here. You know, yesterday I came in and I was interviewed by a radio station, and the first question she asked me, she said, what is an American doctor doing here in Canada talking about hormones? And I said, well, I was invited, you know. I said that's, you know, that's the only reason why I'm here. I'm sorry. And, you know, and I said, so that's one bias I have to come against. And then the second bias is that I'm a man. And you say, well, what is a man doing up here talking about women's hormones? And as Ray Murphy said so eloquently, men are very familiar with women's hormones. I mean, we understand hormones sometimes, I think, better than women because we're from the outside looking in. So, you know, you say, well, I said, well, some of my qualifications is that I'm an obstetrician gynecologist, you know, so I should know about hormones. But my real education about hormones came with my wife. Started having some issues that you may be familiar with. And, you know, what happened was that all of a sudden for 2 weeks I was a great husband. And then the other 2 weeks she was threatening to divorce me and was going to, you know, stab me in my sleep. And I said, man, you know, I've got to do something here. And so I said, because I'd like to stay married and I'd also like to stay alive, too. And so what happened is I started doing what, you know, what OBGYNs do is use birth control pills. Well, here's what OBGYNs do. They do pap smears. I didn't think that was going to help, you know, if I did one of those. And then they give birth control pills if you're younger, and then hormone replacement. None of that stuff wasn't working. And then I did something that was revolutionary, and I could really be put out of the American Medical Association if this got out. I started listening to my patients. And my patients started telling me about all these weird things they were doing. They were rubbing creams on them, taking herbs, and doing, you know, changing their diet. And I said, man, they're going to kill themselves doing this crazy stuff. You know, I said, I need to read about this so that when my patients ask me my opinion, I can tell them, no, you can't do that. You have to do this other stuff. So as I continued to read about these other ways to treat hormonal imbalances, I realized that I was killing my patients and they weren't killing themselves. So this is kind of my educational journey, how I learned these other methods and how I managed to stay married for 18 years, okay? So hopefully it'll help the other men out here to continue along that path. So let's get started. This is what this is really about, is don't be a caterpillar. Now, my dad was a Baptist minister. He passed away about 10 years ago. And in honor of him, what I learned from listening to him, you know, on Sundays is that when you're giving a talk, you give a text, okay, and then you tell a little story. So my text is, don't be a caterpillar. And my story is there's a species of caterpillars called a processionary caterpillar. And processionary caterpillars pick a leader, and then the other caterpillars follow in procession behind them. Therefore, a processionary caterpillar. And that works great as long as the caterpillar is allowed to do what caterpillars are supposed to do. And what caterpillars do is when it's time to eat, they go to the caterpillar restaurant and they eat. When it's time to sleep, they go to the Caterpillar Delta Hotel where it's time to sleep. When it's time to go to church, they go to the Caterpillar Church. When it's time to go play, they go to the Caterpillar Playground, to the beach, and everything works great for those caterpillars, and they just live a long, healthy life. But if you manipulate those caterpillars, and from the outside you influence them to do things that they are not innately designed to do. For instance, if you put the processionary caterpillars on top of a jar, and you put the lead caterpillar here, and then you let the other caterpillars follow in procession behind them, what will happen is that eventually, if you put enough caterpillars on there, that head caterpillar will come around and see that tail caterpillar, and it'll say, there's a new leader in town. I don't know if you know about California, but they'll say it must have been a recall election while I was out of town, and so there's a new leader, so I'm going to do what processionary caterpillars do. I'm going to follow the leader. And so you'll get those caterpillars going around in a circle. They won't go to the restaurant, they won't go to the hotel, they won't do anything. And they'll continue to do that until they die. And none of them will have the courage to get out of line. Okay? Now, that's what I think that has happened in women's health for the last 20 or 30 years. Everybody's been in a processionary caterpillar line. And nobody's been leading. So you guys think that the doctors have been leading this line. But they're not. Okay? You think that your girlfriend, you're doing it because your girlfriends are taking birth control pills and all. You say, well, why are you taking it? I don't know. Everybody else is taking it, and we're all in line, so let's just keep doing it. Okay? But the doctors aren't leading the line. Everybody has been influenced from outside influences, and we're not doing what we are designed to do. Doctors are supposed to follow science and physiology, but we're not. And as we go through this lecture, we're going to see how do we get in this caterpillar line. And what I want to do is to give you enough knowledge and courage that if you see that you're in a caterpillar line, that you'll have the courage to step out of line. Okay? Because it's very hard to step out of line. See, I stepped out of line with the rest of my docs about 4 or 5 years ago, and it's tough because everybody wants you to come back in line. It's kind of like this story that my father used to tell when he was preaching. He said, there was a new census category that needed to be determined. And they wanted to find out how many henpecked men there were in the country. Now, I don't know if that's a southern term, but do you know what henpecked means? Okay. So what they did is that they said, okay, all henpecked line, we mean all henpecked and non-henpecked men, please come to the post office, and we need to get you to sign up. We need to figure out how many henpecked men we have. So in the henpecked line, there was a line around the post office 5 or 6 times, and they were just quietly, obediently in line. And then there was a non-henpecked line. And there was one man in the non-henpecked line. And everybody in the henpecked line said, man, come over here. I know you. You are henpecked as we are. Get over here in this line. And he said, nope, I'm staying in this line. He said, man, what's the matter with you? Get over in line with us. He said, nope. My wife told me to stay in this line, and I'm staying in this line. And so that man, he had enough knowledge as to what would happen to him if he came home and he got out of that line, and he had enough courage to go against those men because he knew what was waiting for him at home. So that's the kind of courage and knowledge that you have to stay out of line. So that's what we want to try and develop today. Now, I told you that the caterpillar will do fine as long as it's allowed to do what it's normally supposed to do. All right? And see, women would be fine if they do what they believe they should do. And see, this is it. Women have an innate sense of spirituality and ability to attune to the wisdom within themselves and the larger whole that has been systematically ignored by medicine. So that's called women's intuition. If you guys were allowed to follow your women's intuition, you guys would be fine. But see, medicine has systematically ignored you. And I found out about women's intuition about 6 or 7 years ago. Because, you know, my wife used to tell me, you know, I don't trust that person. I don't know what it is. I don't have any proof. I just don't feel right. We need to stay clear of that person. And I'd call my wife paranoid and antisocial, you know, and what's wrong with you. But sure enough, as time would pass, something would surface, and what she said was true. And so what I did was, I told you I've been married for 17 years. About 7 years ago, I started listening to my wife's intuition. And I want you to know, these last 7 years have been the best 7 years of my life since I started listening to my wife. And so then, since I started listening to my wife, I started listening to my patients. And by gosh, they would tell me what was wrong with them. Okay? And that's what I wanted to let you know, is that you guys keep following that intuition. And I want you to take that intuition and take what you learned here today, you put that together, and you'd be surprised at the decisions that you can make for yourself. And when you make those decisions based on intuition and on a little bit of knowledge, you're going to get much better solutions than the way that you've been getting information in the past. And then this is the science. See, the reason, this is the headline when the Women's Health Initiative came out in July. You guys you know about the Women's Health Initiative. And I'm going to tell you, that really got started because of women's intuition. Because we kept telling you to take birth control pills for the first 20, from 20 to 40, and then start taking hormone replacement. And you guys kept saying, I don't feel right about that. You know, you're going to have to show me some more studies or something. So they came up with this Women's Health Initiative to try and prove to you guys that hormone replacement was fine in the way that we were doing it. And lo and behold, just like my wife, when she'd tell me something and I wouldn't believe her, lo and behold, you guys were right. You didn't know why, you didn't have any degrees behind you, but you said, my intuition just tells me something is wrong. And again, just like my wife, you were right. And what I've also learned over 17 years, and men who are in here, let me give you a little piece of advice. Don't ever argue with a woman, because you're not going to win. And this is living proof. Okay? You're not going to win. All right, and then this is somebody, and I don't mean to promote her book, but I'm happy her book came out because it's brought a lot of interest in what I do. This is somebody who followed her intuition. She went out and gathered some knowledge by calling docs and interviewing docs, and she put her intuition and her knowledge together, and she wrote a book. And it's a good book. There's some things I don't quite agree with in there, but overall, I'm just glad that it brought attention to what we're talking about today. So I'll give her a little plug. And you know, my book, I wrote that book in 2000, year 2000, so it's 4 years old. Her book has been out for like 2 months. She's been on Larry King and The View and all that stuff. I haven't been on any of that, but I don't want you guys to think I'm bitter or I'm jealous or anything. But, you know, I guess if I had more pouty lips like that, then maybe I could get on those shows. All right, let's get to the meat of this, you guys. Okay, if I'm going to have a seminar, we've got to have goals. All right? And I want you to judge me on those goals at the end of this lecture. All right? So this is my test, so we're going to see if we meet these goals, and then we're going to get to it. The first goal is I want you to become an honorary gynecologist. All right? That seems tough, but it can be done. Because I told you, you're the expert on yourself. You're going to take intuition, you're going to take knowledge, you're going to put it together, and you're going to be an honorary gynecologist. You will be able to diagnose yourself. All right? Because what you learned today, because you feel these things, you're going to be able to diagnose yourself. And then not only are you going to be able to diagnose yourself, you're going to be able to amaze your friends and family. Because you know how girls talk about these little things. You're going to be at your little, your lunch break or whatever, and you guys are going to be talking like women talk. And you're going to say, I went down to the Delta Hotel, and this man from America came, and I became an honorary gynecologist. And so let me sit down and tell you about what's wrong with you, and I'll recommend a treatment for you. You go down to Parkdale Pharmacy, and they'll take care of you. Now, you guys laugh. But at the end, if I don't meet these goals, it's either going to be a thumbs up or a thumbs down. Okay? So you're going to judge me at the end. Then I want you to be able to identify and avoid all caterpillar lines. All right? Seems like a hefty task, but I tell you, you can do it. Every month I give a free seminar at home in Atlanta, and everybody walks out an honorary gynecologist. Okay? So if you're going to be a gynecologist, you got to know what the problem is. And this is women in the United States. Now, this is the first time I've been to Canada, and I told them yesterday I want to thank them for making me an international speaker now. So I appreciate that very much. But this is what happens in these are the statistics of the United States, and I guess they apply to Canada, and we'll see. 80% of women complain of PMS. 20 to 50% of women have fibroids. 80 to 90% complain of perimenopausal symptoms. Premenopausal breast cancer has increased by 30% in the last 30 years. 90% of women have menopausal symptoms. Osteoporosis affects more than 45% of women over age 50. Hysterectomy and breast surgeries are the most common surgeries done in most hospitals. Heart disease and breast cancer are the #1 killers of American women. Now, I want to go back one. See how all of this says 80, 20, 80, 90%? Now, I'm going to tell you a few secrets of medicine, since you guys are going to be an honorary gynecologist. I'm going to tell you some secrets of medicine that if you repeat this once you leave, I'll have to hunt you down and kill you. Okay? So these are one of the secrets, is that when something happens more than 50% of the time, and we don't have a good explanation as to why, we start calling it normal. Okay? PMS. Oh, you got PMS? That's normal. What you complaining about? Hey, you should talk to my wife or my sister or whatever. Everybody has that. Oh, you have hot flashes? That's normal. Everybody has that. But it's not. See, this is women in the United States. If you look at women in other countries, especially in Asia and less developed countries like the United States and Canada, they don't have hot flashes at age 55. They don't even have a word for hot flash. They don't have PMS. They don't have breast cancer at the rate that we do. There's an area in Alaska that has no incidence of breast cancer. However, if those people move here, they will follow right behind with those statistics. Okay? So it's not genetically programmed in women to have these statistics, to have PMS and hot flash. My dad's a Baptist minister, so I use a few biblical references. The only thing God said women would have to suffer is that when they had children, they would hurt. Okay? That's what he said. Nowhere in Leviticus or Deuteronomy or anywhere does it say, oh, by the way, Eve, because of that apple thing, we're going to make you have hot flashes at 55 too. You know, just because I want you to really understand, I'm not happy about that. It's not, so it's something that has to do with our environment and our lifestyle that makes these statistics stand out in the United States and not in other places. So that's what we need to try and find out, what's different about what's happening here than in other places. So if that is abnormal, then we've got to know what is normal, right? Normal, people are a part of nature. And in nature, there are cycles, balance, and transitions. And that's what we're going to talk about. And the example I like to use is the weather. The weather comes in cycles. Spring, summer, winter, spring, summer, fall, and winter. All right? And that has a natural cycle. The moon and the stars, they go around in a cycle. Now, in that cycle, you need to have balance. Okay? If it's too cold in the winter or it's not cold enough in the winter, it's going to interrupt the crops in the spring. If it's too hot in the summer, it's going to interrupt the insect life. So there has to be balance between cold and hot, and there has to be balance between dry and wet in order for everything in nature to work appropriately. Now, also, there needs to be smooth transitions from one part of the cycle to another. In the southeast United States, we're in the springtime. That is a transition from cold air to hot air. And whenever you have a transition, you will have turbulence. Okay? And in the southeast, we get tornadoes. That's the turbulence. Now, also in the southeast, what happens is in the fall, when you're transitioning from warm air to cold air, you get turbulence in the Gulf of Mexico and in the Atlantic Ocean called hurricanes. And you guys experienced this last year with that turbulence. Okay? So nature is about cycles, balance, and transitions. All right? Now, if we're going to talk about women, we have to talk about the menstrual cycle. See how that slide did that? See, are you impressed with how I made that do that? What's the cycle? I did all those myself. So you have to talk about the menstrual cycle. Now, understanding cycles, balance, and transitions, let's understand the menstrual cycle, because I can explain anything in a woman's life by her menstrual cycle. And that's not a sexist statement, but just listen to me. You're born. You transition from a non-reproductive age woman to a reproductive age woman. And with transitions come what? Turbulence. And that turbulence is called puberty, because you're transitioning from one stage of a cycle to another. And then you become a reproductive age woman, and that's governed by the menstrual cycle. And in that cycle, you have to have balance. Just like between warm and cold, you have to have balance between estrogen and progesterone, and we'll learn about that today. And then you transition from a reproductive age woman to a non-reproductive age woman again, and with transitions come turbulence, and that's called perimenopause and menopause. And then you transition on to the great menstrual cycle maker in the sky, right? Okay? And so we've described the whole life by the menstrual cycle, so you've got to understand the menstrual cycle if you're going to understand anything. And so our first goal was what? Become an honorary gynecologist. And to become an honorary gynecologist, the first thing you have to do is complete medical school. Now, I spent 4 years and $50,000 to go to Emory University, and I didn't learn what I'm going to teach you today. I'm going to take you through medical school in 4 slides and 5 minutes. And you're going to know more about women's health than I did about 7 or 8 years ago, okay? And more, I won't say that now because I was going to say more than most physicians, but you had an excellent group of physicians there last night, and hopefully we taught them a little something last night, all right? So the first thing you got to do is go to medical school, and this is the first year of medical school. I told you 4 slides in 5 minutes, right? So time me, somebody. The first year of medical school, estrogen equals growth, makes tissue grow. Progesterone makes tissue develop. That's a normal part of nature. You grow and you develop. Grow, develop, grow, develop. I grew to be 5 feet 10 and a half inches tall. I always like to put that half inch in there because my wife is 5 feet 10, and I have a little Napoleon complex. I want you to know I'm a half inch taller. And then I developed into a husband, a father, a doctor, so you grow and then you develop. That's normal. If you continue to grow and never develop, that's abnormal, correct? This is the second year of medical school. Estrogen is dominant the first 2 weeks. Progesterone is dominant the second 2 weeks of the menstrual cycle, because the menstrual cycle is about 4 weeks long. All right? You got those 2 years down? All right? You're halfway there. You're halfway to your doctorate degree. Now, it becomes tough the third year of medical school. This is tougher. You got to understand anatomy and physiology. But you can do it. And let's just look at here. This is the uterus. This is the tube. This is the ovary. You got that? That's the basic anatomy. This is a 28-day cycle. This is day 0. This is 28 days later. This is the estrogen and progesterone. You can't see estrogen over here, but believe me, that's the red line, and that's dominant the first 2 weeks. And then this is progesterone, which is dominant the second 2 weeks. This is a follicle in the ovary that over 14 days ovulates, and then it makes this, here, which is called a corpus luteum. And then this is the lining of the uterus, all right, how it develops over the course of 28 days. Now, you must understand that God did not make you have a menstrual cycle just to aggravate you once a month. The menstrual cycle is there for reproduction. And so in the context of reproduction and what you learn from the first 2 years of medical school, let's go through a menstrual cycle. So last month you did not get pregnant. This fertilized egg did not take here in the lining of the uterus. So the lining of the uterus sheds, and that causes a menstrual cycle. And so the lining of the uterus is diminished. And then estrogen, which makes tissue do what? Grow. And is dominant the first 2 weeks of the menstrual cycle, causes growth of that lining of the uterus so it can prepare for a possible pregnancy. And it also causes growth in this here that's called a follicle, so that it can mature into an egg, and in 14 days you can ovulate. See, ovulate. Bloop. it comes out of the ovary. And then after what the remnants of this follicle makes something called a corpus luteum, and that corpus luteum makes this hormone called progesterone, which causes development of this tissue so that it can be prepared to nurture this early pregnancy if you get pregnant. And if you do get pregnant, the progesterone continues to increase, you miss your period, you go to the doctor, the rabbit dies, you come home, you tell your husband you're pregnant, and he faints, and you have to resuscitate him, and you have a baby. If you don't get pregnant, the progesterone goes away, so the source for continued development goes away, and this tissue sheds again. And there you go, you have another menstrual cycle. Now, you guys have been having menstrual cycles for 20, 25 years and didn't understand it, but it's as simple as that. That's good stuff. Are you beginning to feel like a gynecologist already? You're in the 3rd year of medical school. You're almost there. And then this is the balance of estrogen and progesterone. And it's important to understand balance. And I know everybody's heard of estrogen, and nobody's heard of this balancing hormone called progesterone. And so you got to understand that there's a lot of progesterone that is needed during the second half of the cycle in order to balance out the estrogen that's made during the first half of the cycle. And again, nature is about cycles, balance, and transitions. Okay? So what is estrogen? You can have phytoestrogens, which are plant estrogens. Okay? And those are like soy and red clover. Those are types of estrogens, but those are real weak estrogens. They don't cause a lot of growth. They just cause a little bit of growth. And these estrogens are in increasing order of how much growth they cause. Estriol is a weak estrogen that's found mostly in pregnancy. Estrone is made in fat tissue, so the more fat tissue you have, the more estrogen you can make. Estradiol is what's made by the ovary every month in that cycle, and it's a relatively strong estrogen. And then there's xenoestrogens, or man-made estrogens. A lot of pesticides and pollutants can behave like very strong estrogens. And even though you may not be exposed to a lot of it, if you're exposed to a little bit of several pollutants and pesticides and a lot of cleaners that you may use in your house, can actually emit substances that behave like estrogens. Now, what is the function of estrogen? Regrowth. Everything in here has growth. Regrowth of menstrual tissue, growth of follicle into an egg, growth of the breast, supports vaginal tissue, develops sex characteristics, stores fat. You guys have been telling us these hormones are making me fat, and we say, oh, we systematically ignore you and say, oh, no, it's not. But the reason why it stores fat is because it decreases thyroid hormone. Let me tell you why it does it, because I told you, you have the menstrual cycle in order for reproduction. And people reproduce in affluent countries like America and Canada, but they also reproduce in other countries that aren't so affluent. And so what happens is during the first 2 weeks of the menstrual cycle, you store fat just in case you might miss a meal or two because you're in a non-affluent country, and so you can use that fat for energy to maintain that early pregnancy until you're able to get to your next meal. So as long as they're in balance, the estrogen and progesterone, one making you store fat and progesterone using the fat, everything works great. But if you're exposed to more estrogen than progesterone, it's going to store fat by decreasing thyroid hormone. You got me? Understand that? So what is progesterone? Progesterone is made by the ovary after ovulation. Progesterone can be made from wild yams and soybeans, but if you eat wild yams and soybeans, you won't be able to make progesterone. Your body can't do it. You take a substance from there, and then the compounding pharmacists can make progesterone from it. And Provera and Depo-Provera are not progesterone. Anybody, you guys know what Provera and Depo-Provera is? They're not progesterone, okay? What progesterone does, it promotes gestation. That's why it's called progesterone. That's the only hormone you need in order to maintain a pregnancy. It is a natural diuretic. It makes you lose extra water. That's what a diuretic does. It uses fat for energy. I told you, see, estrogen makes you hold on to fat and water. Progesterone makes you lose it. As long as they're in balance, everything works great. Just like hot and cold, and everything works fine. It is a natural antidepressant. It binds something called the GABA receptor in your brain, and that's the same place that the antidepressants bind. And so as long as you have enough of it, you won't have depression, during the second 2 weeks of your menstrual cycle. It can restore sex drive, and it protects against cancer. Now, I want to apologize because I really have not given you your proper due. Because I told you in 4 slides in 5 minutes you'd be honorary gynecologist. And I think that we should all give ourselves a hand for completing medical school. And I want you to go home and call your loved ones and tell them that they have a doctor in the family now, and that if they ever need advice that they can call you. All right? So now, to prove to you that you are honorary gynecologist, I'm going to show you that you know more than most doctors. And I'm going to prove it to you by this. Does this look different from that? Simple. See how smart you guys are? I'm so happy that they have a double door back there. Because when you come in, we only open one door. But when you go out, because you're going to have so much knowledge in your head, we're going to have to open up both doors for you guys to get out of here. So see how smart you are? That is progesterone. That is Provera. And see, if you put this into a system that is designed for this, because you make about 17 different kind of compounds. One that makes you lose the fat, and one makes you lose the water, one goes to your brain, but they're derivatives of this. So if you put this in the system, it's not going to give you the same derivatives, right? That makes sense? I say it's kind of like when you go to, you guys don't have Home Depot, but you know what Home Depot is. And you men, you can relate to this. You know, what are the 3 words we hate to see on something from Home Depot? Some assembly required. Okay? And so what happens is that it seems like every time when we go home, there's some extra screws in the box that we don't know what to do with them. And when you don't use those extra screws, or you can't figure out what, then it never works like it did at Home Depot. And that's the same way that happens here. You put these extra screws on here, and it's going to throw the system off, and it's not going to work as well. But we've been using this in place of this, and the problem is that doctors haven't understood that there's a difference. Even in our medical literature, we will interchange these 2 words, and they're totally different. Okay? And then we use this for estradiol, Premarin. Everybody understand what Premarin stands for, and they didn't try to hide it. It's pregnant mare urine, Premarin. So why do we think that that is going to work as well as estradiol and those other estrogens that we talked about? Now, it may be from a natural source, which is a mare, but that doesn't make it natural, because I've never seen a mare turn around and drink his own urine, but we put it in a pill and gave it to women for the last 30 years. Now, it sounds ridiculous, but that's what happened. I mean, that's what happens when you get in a caterpillar line and nobody's leading, is that you'll do kind of ridiculous things like that, and then we told you to do it, so I'm not putting it on you. We told you to do it. I used to send Premarin to my mother thinking I was paying her back for sending me to medical school. And man, I mean, what kind of payback is that? I tell you. So what are the effects of progesterone? Now let me tell you, progestins. How did we come up with progestins? Well, here's what happened, is that back in the 50s, we started giving estrogen to everybody, or Premarin to everybody. And what happened was about 5 or 6 years later, we said, oh man, endometrial cancer or uterine cancer has gone up by 14 times. Not 14%, 14 times. And everybody was surprised. But look, I told you you're honorary gynecologist. What does estrogen do? Growth. Now, cancer is uncontrolled growth. Growth without development. Uncontrolled growth. So if I give estrogen, what is going to happen to that lining that I told you that grows under the influence of estrogen? It's going to grow and then have abnormal development. That's cancer, right? So now, I taught you in 4 slides in 5 minutes about estrogen and progesterone. And so it was predictable that you can have an increase in endometrial cancer if you give the growth hormone without the development hormone, right? It's simple. So why didn't we figure that out before we subjected women to that? See, because we weren't leading the caterpillar line, and we weren't letting science and physiology lead us. We were letting outside influences like Premarin makers tell us what to do. Okay? Now, so then they said, they were in the meeting, I guess, at the Premarin factory and said, what are we going to do? And they said, we'll have to take Premarin off the market. They said, no, 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 no. We'll make another drug that'll counteract the side effect, of the first drug, and then we'll sell 2 drugs instead of 1. They said, man, you're brilliant. You're brilliant. And so they came up with Provera. And it stopped the increase in endometrial cancer because it made secretory endometrium, which is developed endometrium. But because it had the extra screws, it didn't do the other things. It didn't have any positive effects on gestation. It wasn't pro-gestation because it had the extra screws on it. It created a progesterone deficiency because it bound the receptors that would have progesterone on it, and then it had this stuff with the extra screws on it. It made you it increased sodium and water retention. It caused depression instead of being an antidepressant. It caused weight gain instead of making you lose weight, and it was hair loss and increased risk of breast cancer. I told you progesterone decreased your risk of breast cancer. You see, so they tried to solve one problem, and then they made a bunch of other problems because they used something with extra screws on it. Okay? Now we want to talk about balance. So you guys understand the menstrual cycle. You got that? So we're 1/3 of the way through. So now we're going to talk about balance. And I think that our problems have not been to too little estrogen. I think they're due to too much estrogen or an imbalance of estrogen and progesterone. Because this is what estrogen, excess estrogen causes. Breast tenderness, depression, fatigue, poor concentration, endometriosis, fibrocystic breast, PMS, fibroids, water retention and bloating, fat gain around hips and thighs, breast and uterine cancer. Now that's everybody who walks in my practice has that. But I didn't understand that it may be due to an imbalance. And when you have an imbalance, it can be either due to too much of one thing or too little of something else. That's what a balance is. So you can see that all I did was just change the title of this, is that you got to know, is it too much estrogen? Is it too little? Is it too much progesterone? Is it too little? So that's what happens when you have a balance problem. Okay? So then you say, how do you measure balance? How can you measure that? I've never had anybody measure my balance. I go into the doctor and they say, I feel out of balance. You know, I don't know. I mean, I don't mean to be like that, but I just can't help myself. Something is out of balance. And then what does the doctor say? Who cares? And see, that's how you feel. Now, I'm not saying, but I'm expressing how you feel. See, I told you, men, I understand this, okay? And so you say, well, why would a doctor say that? Well, this is what happens. It's because we have been taught gynecology made simple. You know, just like, Microsoft Word for Dummies or Microsoft Word. Well, we practice, and that's what I did for the first 7 or 8 years of my career, is I practiced gynecology made simple. What is gynecology made simple? It's based on this. One key question. You know what that key question is? How old are you? Now see, it sounds comical when I say this in front of the docs. It sounds like, but then they really take a look at themselves and they say, because this is why is that a key question? Because if you're less than 45, I don't care what you come in complaining of, what are you going to walk out of there with a prescription for? But wait a minute, I'm getting to that. Birth control pills. Don't jump ahead of me. See? Now see? She's in graduate school for honorary gynecologist. She's ahead of me. But if you're less than 45, you're going to walk out of there with a prescription for birth control pills. If you're more than 45, you're going to get a prescription for hormone replacement. And here you go. Here we go. If you're greater than or less than 45, you're going to walk out with an antidepressant. And I tell you, you take that so you don't feel so bad about how bad you feel. Okay? So that's why they give you that. But they don't measure your balance. And then if none of that works, no response to the therapy, we cut out the offending organ. Okay? We can't get that uterus to stop. Hey, let's cut it out. But it still doesn't solve the balance problem. And see, the problem was with my wife is that her brain wasn't working right for 2 weeks out of the month. And I didn't think cutting out her brain or lobotomy was going to be kosher, and so I was at a loss. What are we going to do? So then I said, well, it looks like we're going to have to measure balance. Okay? So how do I know if I'm out of balance? Well, I think that the best way to do that It's the spit in the cup. And I'm not saying because you're spitting mad. That's what I want to say. I know you're spitting mad sometime about the treatment that you get when you come to us, but you spit in the cup. Now, let me tell you why you spit in the cup. Because, let me see if it's the next slide. Yeah, because oil and water don't mix. See, hormones are fat soluble. That means they like to be in oily substances. Serum is water. Your blood is water soluble. So how do you get a fat-soluble substance into water and get it transported around? Well, this is carrier protein called sex hormone-binding globulin. I don't want you to remember that. I don't want to be too technical. But what they do is you put the fat-soluble hormone into a water-soluble FedEx truck. Okay? So it gets carried around in the FedEx truck, and then when it gets to the place where it's supposed to be, like your brain or your breast or your uterus or your skin or whatever, those are all the places where progesterone and estrogen gets dumped, it dumps out some estrogen and some progesterone. Now the thing is, it only dumps out just a very little. Even though there may be a lot in the blood, the only thing that matters is how much comes out into the tissue to do what it's supposed to do. You got me? Okay, so here's what happens. Is that what happens is you come to the doctor. You're less than 45. You come to the doctor. They draw your blood. In the blood, what you're measuring is the number, okay? And the number of FedEx trucks stays usually in the normal range, okay? So you draw that, and even though you're out of balance and all these things, draw the blood, you're normal. How old are you? Oh, you're less than 45. Here's your birth control pills. Here's your antidepressants. Okay? So it's very simple. But now, one of the places that the estrogen and progesterone gets dumped or delivered is in your saliva, and it's in proportion to what's getting dumped at these other places. Okay? So if you come to me, well, you don't have to come to me, but if you come to someone who's here who understands this, they'll get you to spit in the cups to see how much estrogen and progesterone is getting delivered to your tissue. Okay? And so you come to me and you say, oh, I feel out of balance. I say, please spit in the cup for me. Let's look at how much estrogen and progesterone. Oh, no wonder. You got all this estrogen getting dumped out and not enough progesterone. No wonder you're feeling like this and you're bleeding all the time and you feel depressed and 2 weeks before your period and all these things. You got me? Now, so we'll correct that and you'll feel better. And we don't give you horse urine and progesterone that has extra screws. We give you whatever you actually need, right? Now, this is what happens when you're menopausal. When you're menopausal, the overall amount of delivery trucks or FedEx trucks goes down. No doubt about it. So when I draw your blood, what is going to happen is, you're low in estrogen. We need to give you more estrogen. But it doesn't tell you how much is actually getting delivered. And I'm going to show you what changes how much is getting delivered. So if you base it on the number of FedEx trucks, I'm going to give you estrogen, and what's going to happen? Your breasts are going to get tender. You're going to gain 20 pounds. You're going to get depressed. You're going to do all these things. Okay? But if you come and you spit in the cup to see how much is getting delivered, and then you actually figure out what is going out to the tissue, then you know what you need to do to balance. And I'm going to show you some examples of that. Okay? Now, you say, what increases delivery of estrogen packages? Well, excess weight. Because one, I told you, remember when I told you the kinds of estrogen? I told you one is made in the fat tissue. So if you draw how many FedEx trucks there are, it's not going to tell you about the estrogen that's getting made in the fat tissue. And that's also getting delivered. Okay? And so more weight you have, the more estrogen is getting delivered. Low fiber diet makes more get delivered. All right? If you want to decrease the amount of estrogen you're exposed to, you eat more fiber and it keeps more estrogen in the truck. You got me? Stress causes you to deliver more estrogen. When I have a patient who comes in and says, all of a sudden my periods became irregular, I ask them what kind of stress they've been under. Have you gotten divorced? Has your parents, elderly parents, come live with you? What has happened? And it will increase the amount of estrogen around, throw off the balance, cause increased growth of that tissue, makes heavier periods, makes irregular periods. You got me? Insulin or carbohydrates causes more delivery, Provera, male hormones. I'm just going to go through this quickly. Other things, our poor diet, our low-fiber, high-fat diet that we have in America increases delivery of estrogen and causes more imbalance at the tissue level. Our sedentary lifestyle, because our sedentary lifestyle leads to more overweight women, and so you have more estrogen being delivered. We are exposed to external estrogens. Estrogens have been given to cows and chickens for years in order to increase their weight and help them hold on to water. So the cow and chicken farmers have known that it increases fat and makes you hold on to water. And estrogen is a very resilient hormone, so when you eat that meat that has the estrogen in the fat tissue, it gets deposited in your fat tissue and causes estrogen and progesterone imbalance. Delayed childbearing. Our grandmothers had about 200 less periods or menstrual cycles than you guys have. Because my grandmother had 10 children, and they were all 2 years apart. And I didn't quite understand that, but having children and breastfeeding was the ortho novum of my grandmother. And so you got to think is that what she would do is she'd get pregnant for 9 months, and she'd make a lot of progesterone. She wouldn't have a menstrual cycle, so she didn't have to worry about getting out of balance. All right? And then she would breastfeed for another year. So that's 2 years she never had a period. Then the ortho novum ran out, which is the breastfeeding, and she got pregnant again. And so for 20 years, she may have had 2 or 3 menstrual cycles. But we are having 1 and 2 kids, and you're having multiple, it says more and more times that you can get out of balance, and you can get irregular, have more delivery of estrogen in your trucks. You see? Okay? And then alcohol abuse, because it damages the liver, which is primarily where you metabolize estrogen, so then that can cause imbalance. So what are the results of these hormonal imbalances? Well, everything you want to talk about. PMS, fibroids, endometriosis, infertility, fibrocystic breast, perimenopause, menopause, osteoporosis, breast, uterine, and ovarian cancer. So we're going to go through this because, see, now it's going to be easy now. Now that you know the fundamentals and you're an honorary gynecologist now, you're going to be able to just boom, 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 just snap right through this. Now, first thing we're going to talk about, hold on. Yeah. First thing we're going to talk about is PMS. And everybody know what PMS stands for? Stands for pretty mean sister. Now, I'm just telling you, now my wife was the poster child. She was a pretty mean sister for 2 weeks out of the month, 2 weeks before a period. I mean, my little boy, who's about 2 or 3 then, when this was all going on, he would go in and be whining to my mom, we'll do this. And I say, Winston, my little boy said, Mommy could snap at any time. You know how she gets. And he said, and he run out of the room because he knew that it was bad. Now, I want to make it clear. If you're a pretty mean sister for like the 1 or 2 weeks before your menstrual cycle, and then after that, you know, you're a pretty nice person, then that's PMS, and that's hormonally related. If you're a pretty mean sister 365 days out of the year, it's not hormones. It's just you need, you know, some other type of help, prayer and something. So just make it clear. It has to be cyclic. You have to have some time where you're all right in order to make it PMS, okay? Okay, so now what is PMS? PMS, 68 to 100% of women complain of tension, nervousness, anxiety, irritability, and mood swings 2 weeks before their menstrual cycle. Now, what did I say progesterone was? It's an antidepressant, anti-anxiety type hormone. So if you don't have enough of that during those 2 weeks before your menstrual cycle, you might experience this. See, it's all about this balance. Right, thank you. 60 to 65% of women complain of weight gain, abdominal bloating, breast tenderness, swelling of extremities. What did I say estrogen? It makes you hold on to fat and water. So if you have too much of that during the second 2 weeks, you're going to hold on to fat and water. 44 to 55% of people complain of sweet cravings, headaches, increased appetite. That is because I told you estrogen blocks thyroid hormone. Thyroid hormone makes you metabolize what you're eating. So if you're not metabolizing what you're eating, you'll eat and you'll still have an appetite and all these things. 36% of people complain of depression, confusion, crying, and forgetfulness. That is also a antidepressant function of too little progesterone. If you don't have enough progesterone causing that antidepressant type activity on your GABA receptors, then you're going to have those problems. And also because of the estrogen blocking the thyroid hormone, that also causes depression. So that's why everybody's getting antidepressants. is not because of low Prozac levels, okay, because you can't draw a Prozac level because your body doesn't know what Prozac is. But it's due to this. So we're covering up a low progesterone problem by giving Prozac and other antidepressants. And because it's so common, that's why everybody's getting it. But we should be correcting the problem, not making the Prozac industry wealthy. Okay, so again, in order to be a doctor, you have to diagnose and treat. So this is how estrogen and progesterone should look during the month. Estrogen, a lot of progesterone. And that's what happens when you measure balance through saliva. And so let's just show you an example. This is a 35-year-old woman who complains of horrendous PMS, irregular bleeding, mood swings. When she walked into the office, it made me nervous. She was just a mess. Now, let's look at this and look at that. Do they look different? This is progesterone during the second 2 weeks of her cycle. This is estrogen. Oh, well, I'm sorry. That. What's wrong? She doesn't have enough of what during the second half of a cycle. So what is she going to have? Depression, mood swings, irregular bleeding, bloating. She's got a lot of estrogen, no progesterone. It's simple, isn't it? You measure cycles, balance, and transitions. See that? Are you guys feeling smart or what? Is it getting to you? Is there a big light coming on at the top of your head? Okay. This is estrogen. This is progesterone. This is someone who has something called polycystic ovary. And they make a lot of estrogen and testosterone and no progesterone. But you can see that. You can diagnose that because you're what? An honorary gynecologist. You can see that just quite clearly. Okay? She's making a lot of estrogen, no progesterone. What do? You give her progesterone. And you can do things to try and lower her estrogen. This is a lady who has infertility. And progesterone is the only hormone you need to maintain a pregnancy, right? She's not making enough progesterone to maintain a pregnancy. It's simple. It takes the mystery out of it when you measure, when you understand cycles, measure balance, and then we're going to talk about transitions in just a second. And then like fibroids are non-cancerous tumors that are found in the uterus. It usually occurs after age 30. Growth is stimulated by declining progesterone. So estrogen will make normal and abnormal tissue grow. Same way with endometriosis. Endometriosis is tissue that should be inside the uterus and should be shedding every month. When it gets outside the uterus and can't do that, it will cause problems like cyclic pain, painful menses, and infertility. So the treatment for that is to try and expose yourself to more progesterone so that it doesn't grow and shed, and that can work a lot of times with mild endometriosis. Fibrocystic breast is caused by overstimulation of estrogen on the breast. Estrogen causes increased cell growth. Estrogen causes swelling by holding onto the fat and water, and that's why you feel like that 2 weeks before your period. You can get breast tenderness and fibrocystic breast because you're getting overstimulated by estrogen. So we talked about cycles and balance. Now we're going to talk about transitions. And transition we're going to talk about is perimenopause because it's kind of like puberty in reverse. Okay, and you may feel like that, and the worst scenario for us men is to have a teenage daughter going through puberty and a perimenopausal woman. That's kind of like, that's like, say, God, get me through this, please. And so it's very important for you to understand those transitions, okay? What is perimenopause? It begins 10 to 15 years prior to menopause. You get erratic hormone production, anovulatory cycles, increasing estrogen and declining progesterone. Now, I went through that real fast because it really is a matter of this. Eggs and age. Now, let me tell you what happens during perimenopause. You have the most eggs that you're ever going to have in your life 20 weeks before you're ever born. That's women, not men. Women have eggs, okay? Women have the most eggs they're ever going to have in their life 20 weeks before they're ever born. So this is time. This is a 0 to 50 in years, and this is number of follicles, those little cells that become an egg once a month that ovulates. And now, starting from age 0, the amount of eggs start to decline. And the good eggs go first. That's why your 18-year-old daughter, she holds hands with a guy and she's pregnant. I know it really, but I know they try and make us believe that's all they did. But anyway, it's easy to get pregnant because the good eggs go first. And then at age around 35, see how the slope of the curve starts to decrease? I'm saying start to increase. So the rate of diminishing eggs goes down, it goes even faster. And what happens is you start to scrape the bottom of the barrel of the egg basket. And that's when, you have to have sex like 12 times a day and stand on your head and, for 3 hours to try and get pregnant because it's trying to scrape that egg off the bottom of the egg basket. And that 35-year-old egg needs some prompting to get up, okay? And so it's a lot of estrogen being made to try and scrape that egg up off the bottom of the barrel. And so then what happens is it may ovulate, it may not. And if it doesn't ovulate, you don't make progesterone. Or it may ovulate very weakly and it doesn't match the amount of estrogen that it took to get it there. So you got a setup for imbalance, right? And so what happens is during this time, you will get a lot of estrogen and not much progesterone, and so all these things start to happen to you. You start to gain weight. You increase risk of breast cancer. You have fibroids grow. Your endometriosis gets worse. And we try the birth control pills and the hormone replacement, and if the offending organ doesn't stop doing what it's doing, what do? We cut it out. And it usually happens all during this perimenopausal period, but it's due to turbulence in that transition. See, that's the hurricanes and the tornadoes in those transitions. It's right there. So what happens is you miss a period if you don't ovulate, and then 2 weeks later or whatever you have heavy periods. It's because of fewer eggs, no ovulation, no progesterone. Progesterone is the menstrual timekeeper. If you don't ovulate and make that corpus luteum and have those 14 days of progesterone, then you don't know when to bleed. You'll bleed every 2 weeks, 4 weeks, 6 weeks, 8 weeks, $1, all four. Anyway, so, and then you get these estrogen excess symptoms. You get the depression, the mood swings, the irritability, all of those things because of difficulty in that transition. This is a lady in perimenopause. This is her estrogen, this is her progesterone. What's wrong with that? It's flipped upside down. The estrogen should be down there and the progesterone should be up there. It's just like what I told you. She made a lot of estrogen trying to scrape that egg up, and then the progesterone wasn't able to meet the challenge. Now, let me just tell you, is this simple or not? Isn't this simple? Why hadn't we been doing this? Just say, oh, you mean all I got to do is spit and you'll get a graph like that and I can look at it? I don't have to draw any blood. You don't have to do any, you don't have to take any x-rays, none of that stuff.
Bring some cups.
He gonna have some cups, I know. That's what I tell you. I mean, it's really, it's like, why didn't we do that? Because we were in the caterpillar line. And so when you're in the caterpillar line, you can't see anything else. You're just doing this, and that's what we did. And we got you to follow, but thank God for your intuition. You said, you got to find another way. That's what you, see, this is what I tell you. See, you guys are, most of you in that baby boomer generation. And I'm going to tell you, see, baby boomers don't take anything lying down. See, and then, see, you guys change medicine. We don't change medicine. Let me just give you an example. You guys changed the way we deliver babies. You said, you're not going to put me in a room and knock me out, take my baby out, and then wake me up and say, here's your baby. You're not going to do that to me. I wanted to feel like home. So now they have all these great, at least in America, they have all these great birthing centers, and they look like the Taj Mahal. They're better than the rooms here. And they have all the woodwork and the primer. And it's not because a group of docs said, why don't we make the birthing experience more, more pleasant for the woman? I mean, we didn't. You guys demanded something, and it changed the way we deliver babies. You guys have demanded, you're going to have to find something different. I'm not going to do this taking horse urine and stuff in menopause. I'm not going to do it. And it's going to change. And I tell docs, it's like you think the atomic bomb is powerful? You just get you a bunch of baby boomer women, all of one same mind, and things will change. And I tell these docs that either you can change or you'll be left behind. Because you guys aren't going to take it. I mean, I know it. Thank you. See, now, this is what I tell you. Let me just let you understand what I'm familiar with. My dad was a Baptist minister. So when you hear the truth, you say what? Amen. Thank you. So you say amen. All right, so see, make me feel at home and say that. All right, so now let's talk about menopause. See how it kind of creeps up, you know? That's how I did that. Yeah. See, everything, you know, it's all about image and, you know, perception. See, so I did that. All right. So what is menopause? Menopause is permanent cessation of menstruation caused by decreased production of ovarian hormones. Mostly occurs between age 48 and 52. And see how I put that S on there, hormones. It has more than one hormone. It's the decreased production of estrogen and progesterone. Now, this is what happens in menopause. I told you the number of trucks go down. So if I measure your blood, it's going to say you're low in estrogen. But it doesn't necessarily mean that you're not delivering the same amount to your tissue. Because this is a saliva test. I don't have to do that month-long test if you're menopausal. This is estradiol. I told you that's the main estrogen. Now, this lady's 54 years old, hadn't had a period in 2 or 3 years. She has hot flashes, mood swings, all of those things. Okay? Now, but you look at her estradiol, how much is getting delivered to a tissue, it's 13. And normal for a premenopausal woman is 5 to 13. So she's still delivering the normal amount to a tissue. How can she do that? She's overweight, has a low fiber diet, exposed to external estrogens. Her fat tissue is making estrogen, you see? And it won't get measured if you measure in the delivery trucks, but it'll get measured if you measure what has been delivered. Then you look at her progesterone, and her progesterone is 80, and it should be between 100 and 300. If you're at the upper limit of normal here, you should be at the upper limit of normal here. I just use as a general rule for this lab, it should be a 20-to-1 ratio, because 5 times 20 is 100, 13 times 20 is 260, they just rounded it off to 300. Excuse me. You understand what I'm saying? So whatever amount of, because we're talking about balance, it's not absolute numbers. If you have a high estrogen, you need a high progesterone to balance it out. If you have a low estrogen, you need a low progesterone to balance it out. That's a simple concept. So this should be around 260. So I don't give her Premarin, which isn't estradiol anyway. I don't give her Provera, which isn't progesterone. I give her progesterone. Try and get that number up to about 260, and our hot flashes go away. She doesn't have any mood swings. She doesn't have any extra weight, because I'll restore balance, get her back to how she's supposed to be, and life is wonderful again. Now, these are all the places that she can make that extra estrogen I told you. This thing called a pineal gland. All of these places are where you can make extra estrogen. But there's not any place where you can make extra progesterone. Okay, so that's what happens. The estrogen and progesterone should go down together, but because we have these external factors that can increase our estrogen production, the progesterone goes down to here and the estrogen doesn't go down to match it, so it causes an imbalance. Now, this is another lady. This is a lady, her estradiol is 26. Now, this is what she complained of. She was 55, 56, hadn't had a period in 4 or 5 years, complained of hot flashes, mood swings, losing hair, and decreased sex drive. So this is her numbers. Her estradiol was 26. Now, I told you normal, the upper range of normal is 13. So she was double what she should have been even when she was premenopausal. How can she do that? Stress, diet, you know, all those things. We got that. That's how you can get extra estrogen. Her progesterone was negligible. It was less than 21. Okay? So she is obviously out of balance. Now, I want you to look at this. This is her testosterone. Now, your body tries desperately to stay in balance. So it says, wow, I got all this estradiol around, and there's no more eggs in the egg basket, so I can make progesterone. So it panics and starts to make a male hormone called testosterone. And you guys know what testosterone is. Now, her testosterone is 64. Normal is 8 to 20. So she elevates her testosterone level trying to balance out this estradiol. And what happens when you do that is that you start to have effects of high testosterone. What are those? Male pattern hair baldness and growing a mustache. If you don't understand this, what you would do is say, oh, she's turned into a man. She needs more female hormone. So we give estrogen thinking that that's going to help. But what is that going to do? That's going to throw her more out of balance. Right? Now, also, we are forming this caterpillar line to say that these women with low libido need testosterone. Now, this lady's testosterone is 3 times normal. She should be hustling men on the street if she's got that much testosterone running around. But because we just assume that if testosterone increases libido in men, it must do the same thing in women. But that's not necessarily so. Sometimes I think that's an issue, but I see women all the time who have high testosterone levels or normal testosterone levels who come in and say they have low libido. Now, somebody was asking me last night, that has become an epidemic, low libido in women. Now, let me tell you what my theory is on that. I think maybe 10 to 15% of the time it is hormonal. I think the other 85% of the time is situational, and this is the situation. Is that men have sex in order to relax. If they have a hard day at work, sex is just tops off the evening for them. Women have to be relaxed in order to have sex. Okay, so I ask these patients, okay, you have low libido. Tell me what you do during the day. Oh, I wake up at 5:30, I have to get my 3 kids off, and then I have to go to work, and then I have to come over, I have to pick them up, I have to do the homework with them, and then I have to get the kitchen together, and then about 10:30, 11 o'clock, I get the kids to bed, and then I'm ready to go to sleep. And then my husband is saying, and so, right. And so, you know, I've learned with experience that if my wife has a bad day, that's the time for me to turn over and watch SportsCenter and go to sleep. Okay? And so I try and tell women it doesn't have anything to do with your libido, it's situational. You know, and so that's why I'm saying, oh, low libido, we need to give you testosterone. I think that's another caterpillar line. Some people need it, but I don't think that's it. But anyway, I digress. Let me move on. Now, I'm not telling you that estrogen is bad and that no one needs estrogen. I'll tell you no one needs Premarin, but I'm not telling you that no one needs estrogen. So what you do is, this is a lady who said, oh, I'm not going to take estrogen. No, it's bad for you. But she was taking progesterone. Her progesterone is absolutely normal, 207, it should be between 100 and 300, but she's having hot flashes all over the place. And I said, well, will you please spit in a cup for me? She said, yeah, sure I will. But look at her estradiol, it's less than 2. She's out of balance the other way. So it's not about estrogen is good, progesterone is bad, it's about balance is good and imbalance is bad. So I gave her estradiol. And this is her follow-up test, this is 10. This is 280. I told you about a 20-to-1 ratio. 20 times 10 is 200. So she's back in balance. Her hot flashes went away. See? All right, and this is a 60-year-old without a uterus. And she wasn't having any hot flashes. She didn't have uterus or ovaries. She wasn't having hot flashes. How do you explain that? Well, look, it's not about overall numbers. It's about balance. Her estradiol is 2. Which is normal for a postmenopausal woman. Her progesterone is 44. 2 times 20 is what? 40. See, that's what happens in most countries why they don't have hot flashes or anything, is because their estrogen goes down and their progesterone goes down proportionately. They don't eat the wrong foods. They don't have a low-fiber, high-fat diet. They're not under the stress we're under. They're not exposed to the environmental hormones that we're exposed to. So that's why in Asia and these other countries, they don't have to take anything and they live a long, healthy life. But because of the external factors, we don't often see this. Okay? It's cool stuff, isn't it? Is this cool? This is good stuff, I'm telling you. Y'all catch that? That's good, isn't it? Y'all like that? See, hot flash. Okay, so then this is what you'll say. You'll say, yeah, you little American man doctor from America coming up here to Canada, you think you're so smart. Why did that Premarin get rid of my hot flashes, Mr. Smarty Pants? Okay, well, let me tell you why. It's like, please pass the salt. Let's just look at this. You have a salt addiction. I mean, you're one of those people, you don't taste your food, you just pour salt on it. So then you come to somebody's house and they have high blood pressure. They don't use salt, but they put garlic and rosemary and all this stuff on the chicken, and it's great. Everybody thinks it's great. You eat it and say, where's the salt? Okay? And so what happens is you say, please pass the salt. So you pour more salt on it. And that makes you feel good for right then. But long term, it's going to cause you problems. It can cause kidney problems. It can cause high blood pressure. But for right then, you feel great. Now let's look at estrogen and progesterone. I told you during perimenopause, you make a lot of estrogen and not much progesterone, trying to scrape the bottom of the barrel of the egg basket, right? So you're used to this high estrogen level, high estrogen level, and then what happens with menopause, your level will go down. And it's kind of a withdrawal reaction of this high level to this low level. That's why you get the hot flashes. You get this withdrawal reaction. Okay? Now, what can you do? You can pour more salt on it. Pour more estrogen, get you back up to that level. My hot flashes are gone. But just because it works with the hot flashes doesn't mean that's the best thing for you. Right? My kids can say, Dad, I'm hungry. I can say, well, here's a Snickers bar and a blow pop, and they'll say, woo, Dad, that worked. I'm not hungry. Well, that doesn't mean that's the best thing for them just because it worked. But that's what I thought was, hey, it works. Let's try and sell it. You see? So now the other thing you can do is use a salt substitute. The salt substitute will get rid of that craving, and it won't cause the long-term problems. And that's why you can use weak estrogens like estriol, or you can use soy, because that's a weak estrogen, and it's a substitute. It'll bind these receptors and say, at least we got some estrogen. I feel much better. Okay? Or you could try and decrease your salt taste buds. You could just go in and kind of cut your salt taste buds out. Now, that's not feasible, but you can do that with estrogen. Progesterone decreases the amount of receptors looking for the estrogen, so you're satisfied with less. That's why progesterone gets rid of the hot flashes. Or you can just get over the craving. Eventually, your body will get used to that lower level, and that may take 2 to 5 years. I'm not telling you to do that, but your body will reset to that lower level. So what we're trying to do is to help you through that transition, that turbulence of trying to let your body reset to that lower level. Okay? Osteoporosis. I'm going to talk about that and then we're going to finish. Osteoporosis, progressive bone loss that leads to increased risk of bone fracture. Most common in women of North European descent. Risk factors are smoking, steroid use, thin frame, and sedentary lifestyle. What I want to get across to you is not everybody is at risk for osteoporosis. Now, just to let you know is that astronauts, when they go out to outer space, they're at risk for osteoporosis. Why? Because they don't have any weight bearing. And it's kind of, if you don't use it, you lose it. So if they're not bearing weight on the bones, they start to waste away. That is much more important than any hormone issues in osteoporosis. And then you got to look at these risk factors. Smoking, if you don't smoke, if you don't use steroids, if you're not a thin frame, and you don't have a sedentary lifestyle, you are not in that much of danger of osteoporosis. You need to understand that and don't get in that caterpillar line, because if I live in Atlanta, we have a high African-American population. I have these 250-pound African-American women say, don't I need estrogen for my bones? I say, I don't think so, because one, you don't have any of these risk factors. You've got an estrogen factor in those 250 pounds that you've got, and that if you will walk around my office 3 or 4 times, there'll be plenty of weight-bearing exercise, and I don't think you're going to need the extra estrogen. So, I mean, it sounds funny, but I'm going to tell you, people who are more than 20 or 30% overweight, they are not, and they at least move around, they are not going to have osteoporosis. So to say, I've got to have estrogen to protect my bones is crazy. Especially if we're not measuring to see if there's an actual problem. If we measure and see that there's an actual problem, then we need to supplement. Synthetic estrogen is not a cure. Estrogen slows growth and bone loss for a limited time. Bone loss begins at age 35, so it prevents bone loss as well as estrogen. And progesterone actually can stimulate bone growth. Then the other thing I want to talk about is that everybody with osteoporosis is saying, or worried about osteoporosis is saying, how much calcium should I take? Isn't that what you're saying? Now let me tell you, 75% of the world does not drink milk, they don't take calcium pills, and they don't have osteoporosis. How do you explain that? Well, this is what I'm telling you. Everything is about balance. It's not necessarily how much calcium you put in. It's also how much calcium do you let come out. And how do you let calcium out? By doing these things, by eating animal protein. In order to neutralize some of the chemicals in the acids in animal protein, you have to leach calcium from the bone in order to let you urinate those toxins out. Also, carbonated colas have phosphorus in it, and those carbonated colas make you lose calcium. Refined sugar and caffeine. Now, let me tell you, they did a study of juveniles, and they found that they are breaking their bones at a much higher rate than other kids in 30, 40 years ago. And they found out that it was associated with how much animal protein, and sodas they were drinking. And what, at least in America, the teenage diet consists of a triple cheeseburger with a biggie Coke that is jam-packed with caffeine and refined sugars. So no wonder they're breaking their bones, and osteoporosis is going to be an epidemic in the future, and not going to have anything to do with estrogen and any of that stuff. It's going to be due to what we feed our kids. So I'm just telling you, we got to understand what's going on and not get in a caterpillar land saying, as long as I take my estrogen and my calcium, I'm not going to have osteoporosis. It doesn't make any sense. Now, we're going to talk about cancer, and we're going to be done. And cancer. Estrogen increases cell growth. We already talked about this. You guys are so smart now, I don't even need to go over this. Estrogen increases cell growth. Progesterone increases normal development and slows cell growth. That's the balance that you use to prevent cancer. And just to show you this was a study done at Johns Hopkins. They looked at women with progesterone deficiency. These were women in an infertility clinic that had low progesterone, because you got to have progesterone in order to maintain a pregnancy, correct? So they looked at these women 33 years later, and they found that they had a 10-fold increased risk of death from all cancers. Why? Because progesterone stimulates normal development. And not only of the uterus, but it seems like other cells also, because they were at higher risk for cancer. And it definitely does it in the breast, because people who had low progesterone had a 5.4-fold increase, not a percent, 5 times more increased risk of premenopausal breast cancer. So you see how important that progesterone is? And then when we look at the Women's Health Initiative, I know you've seen this, but this is what they found out. But again, this shouldn't be that surprising. If we gave Premarin and Provera, two things that your body's not used to, and we gave it to everybody without measuring whether they needed it or not, just think, if I gave high blood pressure medicine to everybody and never took their blood pressure, do you think you'd get a positive result from that? But that's what we did. We gave you hormones. We never measured it. We never measured to see if you needed it. Then once we gave it to you, we never measured it to see if it was the right dose. We said, come back when you have a side effect. And in some of those people, the side effects were breast cancers, cardiac events, strokes, pulmonary emboli. Okay? And then they found this, that there was probably 120,000 more mammograms that were read as abnormal, solely due to people being on hormone replacement therapy. So that's 120,000 women who were scared to death, thinking, I'm not going to be able to live to see my grandchildren, and they had to go and get a biopsy and an ultrasound and the pathology report and all those things, and all of that anxiety provoking to 120,000 women each year that was just due to hormones that they didn't need to be on. And then an advisory committee commissioned by the National Toxicology Program of the National Institutes of Health to help compile the 10th report on carcinogens has recommended that steroidal estrogens be listed as substances that are what? Known to be a cause of human cancers. And this came out in like 1998, 1999. So we were giving out substances that were known to be causes of human cancer. We never measured it to see if you needed it, and we never measured it to make sure that you're on the right dose, but we gave it out like candy. And people are still doing it. Indications for estrogen: high risk for osteoporosis, which is symptoms of menopause, that's it. Has nothing to do with heart disease. I used to have to go and explain this, but there's no doubt about it that it does not help decrease the risk of heart disease. It actually increases it. And this just shows that. Dr. Taylor's indications for estrogen, or progesterone, or anything else. You need to have a salivary test to tell you whether or not you need it or not. I wouldn't give you potassium without drawing your blood to see if you need potassium. I don't care what kind of symptoms you came in for. Something as simple as potassium, if I give it to you and you don't need it, and I tell you to come back when you have a side effect, you know what the first side effect of too much potassium is? Thank you. Just something simple as potassium. Give it to somebody and they don't need it, and we found out that's the side effect of estrogen too. It can be death. So we need to measure it, and we don't need to give it unless we know that you need it. When is synthetic estrogen the only choice? Never. What can you do? You can eat organic fruits and vegetables. Why do you do that? Because they don't have pesticides on it that can act like estrogens and increase the amount of delivery of estrogen to your tissue. And then organic fruits and vegetables are grown in soil that actually have the vitamins and minerals that you need to metabolize estrogen. A lot of commercial farms are grown in soil that don't really have what they need to have the broccoli and the cauliflower to have everything in it that you actually need to have in it. You increase your fiber. Why is that? Because it decreases the amount of estrogen that's delivered. Also, fiber makes you have more bowel movements. You should have 2 or 3 bowel movements a day because that's how you get rid of extra estrogen. If you don't get rid of it through your bowel movements, you'll actually reabsorb it, and now you're dealing with yesterday's estrogen along with today's estrogen. Okay? Omega-3 and omega-9 fatty acids helps your cells to not respond so strongly to the estrogen. So that's like olive oil and canola oil, all of those things. They help with that balance. Low glycemic index foods so that you will decrease the amount of insulin that you make because insulin causes the imbalance to be more pronounced. You decrease your animal protein, okay, because that has estrogen in it. You eat organic or hormone-free meats. You increase plant protein, soy, and other beans. I know you guys are writing this down, but if you go to my website, www.areyoughormonesmakingyousick.com, or you know the best thing, you know what a great idea is if you buy that book back there. But not to seem like I'm promoting my book now. All right, then you do lifestyle changes. Increase activity, decrease that sedentary lifestyle. You reduce stress with prayer and meditation. That has been shown to do wonders. We got to get out of this stressful environment. Also consider career changes. Don't let your job kill you. Because that stress, you see how it can cause imbalances and it can cause problems with your immune system. You have increased risk of cancers if you're under stress. Be bold enough to step out of line and say, I'm not going to let this job kill me. Either you have to change your response to the job or you're going to have to get out of the job. Supplements. You eat whole foods. There's whole food supplements that you can take to get those vitamins and minerals that you need from organic foods. Vitamin B complex, folic acid, magnesium, vitamin D, and boron are very important for osteoporosis. You use phytoestrogens like soy, decreases your cholesterol, reduces hot flashes. You use bioidentical estrogens. If you need estrogen, don't take horse urine. Like I said, the horse doesn't take that. Why would you take it? There's things like Biest, which is estriol, which is a very weak estrogen, and estradiol, Triest. And you ask Lisa, she's an expert about that, right, Lisa? About Biest and Triest, all that, she'll do that. Black cohosh, red clover, all of these are alternatives. Micronized progesterone, cream or oil. There's progesterone creams. When you need progesterone, don't take Provera. You need to use progesterone. You can rub it in on your skin because it's fat soluble. It gets absorbed in the fat tissue. It's actually more potent if you do it that way than if you take it orally. But you also can take it orally. It's effective from puberty throughout life. 20 to 40 milligrams a day is usually sufficient. It maintains or increases quality of life, no disruptive side effects, no increased cancer risk or heart disease, may help prevent degenerative diseases. These are other hormones that can make you sick. I won't talk about these today. We're going to get to this because it's time to go. All right, now it's my moment of truth. Here we go. Let's go over these goals. Do you or do you not feel like you are an honorary gynecologist? Yay or nay? All right. Are you or are you not able to diagnose yourself? All right. Will you be able to leave this place today and amaze your friends and family? All right. Will you be able to identify and avoid all caterpillar lines? All right. My work in Prince Edward Island is officially done. Thank you very much.
Dr. Eldred B. Taylor, a luminary and pioneer, is a powerful, provocative, and life-changing motivational speaker who possesses the prowess to meet his audience at their point of need. Dr. Taylor speaks on a variety of topics and will bring life to any event. He is able to convey thought-provoking and inspirational educational information to diverse audiences while entertaining them with his humor and wit. For booking information or to find out more about this dynamic and unforgettable motivational speaker, please contact us today